Great, thank you. Good evening and welcome to Georgetown University's Doctor of Nurse Anesthesia Practice webinar. We are hosting this session to provide information about the doctoral program and to answer any questions that you may have about our curriculum, as well as the application process. A few logistics before we begin. During this webinar, you will hear presenters, however, we will not be able to hear you. With that in mind, we want you to know that we welcome your questions, and you should see a space at the bottom of the control panel where you can type your questions, which we will answer at the conclusion of the presentation. If for any reason you cannot access the control panel, please type your questions in the chat box on your screen, or feel free to email me at any moment after the webinar, and I'll make sure to respond to, at a later time. Please note that this webinar will also be recorded for you to access at a later time, and we will post it on our website. I will also send you a link sometime after the webinar is posted, a link to the website and also the webinar for those of you who want to refer to it again. Again, thank you and welcome to our webinar. Let's begin, shall we? All right. With us today is our Assistant Program Director, Dr. Carrie Bowman-Daly, and myself, Edith DeLeon, Program Manager, along with our Class of 2020 Teacher Assistants, Carter Grislier and Maggie McDonald. Also with us is Class of 2020 Student Rep, Kayla Richards, and Ms. Marian Lyons, who is our Assistant Dean of Academic Affairs. Thank you all for joining us tonight. The agenda for tonight is, for this information session, will be split into two parts. Dr. Bowman will review the program curriculum aspects and admission requirements. And we will conclude with answering questions that you might have posted throughout the webinar, and we will give you an opportunity to ask those, and our students will also be able to and available to answer any student-to-student specific questions. And the second part of our webinar will be, again, just FAQs. Dr. Bowman will now proceed with part one of the program information.
Hello, everyone. My name is Carrie Bowman-Daly, and again, I'm the Assistant Program Director. I am also a former graduate of the program when it was at the master's level back in 2004. And then I came over in about 2006 to start teaching and decided I absolutely loved it. And so I ended up getting my PhD in pharmacology from Georgetown's Department of Pharmacology and Physiology. I finished that about 2 years ago. And over the last, well, I guess I've been teaching now almost 12, 13 years. And throughout that time, I've also continued to practice anesthesia at Georgetown University Hospital. I'll be there again this Friday. And that's something I think that sets our group apart, is that we all continue to practice so that we're able to really not only bring you the knowledge from the textbooks and from science, but also kind of tell you what all of this means in the real world and talk about issues that are changing in day-to-day clinical practice. So we're all very proud of our clinical practice and think that's a really important part of our professional obligation to our students. So I'm happy to answer any other questions about my journey later on. But now I'd like to jump right into our program. We're very proud of our program. We have been consistently ranked as a top 10 nurse anesthesia program by the U.S. News and World Report. And we've been consistently awarded with HRSA traineeship funds. We were able to distribute those funds to our current class, which was very helpful, I think. I believe each student received about $1,000 towards their educational costs, which we were happy we were able to do. We have a very unique approach to teaching anatomy and, more importantly, teaching regional anesthesia in the anatomy lab. If you end up coming to our program, the first spinal you place, the first epidural you place may be on a cadaver, which is really a nice way to get used to the equipment, to understand the sequence of events. And of course, when you're working with a cadaver as opposed to a real person, although it's not exactly the same, or in some aspects not close to even being the same, it gives you the experience of understanding the anatomic relationships to providing a regional block. And as a student, I really appreciated it. I think it really sets our program apart that you are able to use all of the regional equipment in the anatomy lab. We also have a standalone anatomy course taught by Nicole Grass, and she really focuses on the anatomy that's critical to our anesthetic practice. So you'll spend a lot of time, if you come to our program, focusing on airway anatomy, focusing on the brachial plexus and the distribution of those nerves, because of course those are cornerstones to our practice. And perhaps we won't spend as much time on, for example, the reproductive system. So she's really catered that nicely so that you really learn the critical aspects of anatomy that apply to anesthetic practice, and even, the parts that are really important to understanding what is happening surgically to your patients. We do offer clinical placements once you get to phase 2 of the program and you're in clinical. And we have really a wide range of settings across DC, Maryland, and Virginia. We also do have some alternative sites. One we're very proud of is in New Mexico, where we send students to the Navajo reservation, and they're able to practice under preceptor guidance in they're able to see a fairly autonomous CRNA style practice in a very unique population. So we work very hard so that our students see really the full range of anesthetic practice. And we prepare you to really kind of go out there and practice in the area of specialty that you desire. We always say that you graduate as a generalist and you specialize once you go into your individual practice with your CRNA license. But we really do provide you the foundation to pursue any aspect of CRNA practice that you desire. The Student Journal of Nurse Anesthesia was actually founded at Georgetown by former faculty, and we still really encourage our students to submit articles. I've been on the editorial board for over 10 years, and I'm very proud of the many papers our students have published in that journal. And of course, one of the major goals of this program is to prepare you to pass the national certification exam for nurse anesthetists. And we have a very good track record of preparing our students to pass that exam with flying colors. Okay, I'm ready for the next slide. So currently we have 6 full-time CRNA instructors, which is a really nice student to faculty ratio. And as you are out shopping around for various programs, we really encourage you to ask that question of the programs. How many faculty members are there per student? And this faculty ratio really allows us to provide individual attention to students. We very quickly know every student's first name, and we have an open door policy. It's very common to hear one of us tutoring for 2 to 3 to 4 to 5 hours a day around critical periods in the curriculum. And we're able to do that because of our nice ratio. Dr. Ladan Eshkavari is our program director. She's been with the program for over 20 years. She has a PhD in physiology, so she is able to teach a lot of the basic science content along with me. My focus, of course, pharmacology. And then Joe Garman here, he is our only full-time faculty member that is not a CRNA. He's a physiologist, and he teaches a lot of the biochemistry, physiology, pathophysiology. He's here on the left in this picture. And then we also have Crystal O'Gwen, and she'll be taking over a lot of the advanced principles courses. We have Nicole Grass, who I already mentioned, is working on her DNP. She'll actually be done just around when your cohort, or if you end up coming to our program, this new cohort will start. John Litchfield is former Navy, and he brings really rich experience in regional anesthesia and also combat anesthesia. So he has a very interesting perspective to help round out our group. We also are actively recruiting for one additional CRNA faculty member that we would expect would be in place before the next start date in June. Okay, so here is our curriculum overview, and it can be, I suppose, a bit overwhelming. But as you can see from looking at it, year one in blue, we cover a lot of the basic sciences in this first year. So you'll see there is no clinical component. We may have some observational experiences where you may go into the OR and spend a half a day or 8 hours observing, but for the most part, the priority of this first year is getting the basic science foundation to provide anesthesia care. So year one in the summer, you start off right away in chemistry and physics with Dr. Garman, where he pretty much covers all of the major chemistry and physics concepts that have a direct application to anesthesia practice. So, for example, the gas laws are very important because we administer volatile anesthetics as one of our primary means of general anesthesia. So you'll hear a lot of that. And then we go into Intro to Nurse Anesthesia, where we teach you about the anesthesia machine, some basics like positioning. We talk about the OR environment, and then you'll take health informatics and healthcare systems in the summer as well. And then you move into the fall, and as we've heard from now 2 cohorts, the fall is when things really pick up. It's a much more intense semester and really requires you to be fully engaged in school. So we always say, you really cannot work as much as you think you're going to be able to fit that in. Your schedule will be 24/7 studying. And this semester, you'll take gross anatomy, advanced physiology, anesthesia safety and quality, and anesthesia pharmacology. And one thing that we try our best to do is to marry these different courses. So we're covering the same sort of material in each of the courses. So for example, when in physiology, you're learning about the lungs, that's when we'll start talking about volatile anesthetics and anesthesia pharmacology. We also won't talk about neuromuscular blockers until you've gotten all of the physiology of the neuromuscular junction in physiology. So we're very careful at how we schedule this, and it's very purposeful. Same thing with anatomy. If there's something critical for you to understand in anatomy that impacts physiology, we make sure that that is really carefully married. And then you move into the spring. In the spring, we have advanced pharm. You'll notice we have 2 different pharm courses here. Advanced pharm is going to be more the drugs your patient's coming in on, whereas anesthesia pharmacology is the actual drugs that we give day to day in the OR. So in 661, pharmacology will cover things like neuromuscular blockers, volatile agents, local anesthetics, etc. Whereas in the spring, we're going to cover things like antihypertensive or ACE inhibitors, which we don't typically give in the OR. In fact, we usually want our patients to hold that the morning of surgery. But of course, we need to understand the side effects, the mechanism and all of that, because our patients are under the influence of those drugs. So again, when we're teaching that, we're teaching it along with pathophys, health assessment, and anesthesia and coexisting diseases. So while we're learning about antihypertensives, we're also learning about the pathophysiology of hypertension. We're learning how to assess a patient who presents with hypertension, and then we're learning how to plan an anesthesia care plan with someone with hypertension. So we're doing it, even though they're individual classes and they are taught in distinct periods, we're following the same sort of pattern in all classes. So you kind of get to study the same thing in multiple places, and this kind of helps your understanding, and it helps one class studying benefit, your whole effort. You also will have healthcare policy during the spring, which is very exciting here in DC because you'll have the opportunity to go on the Hill and be part of AANA's mid-year assembly, where you'll meet with Congress people and learn how to advocate for your profession. And that's something that not every school can offer. And it's fairly easy for us to offer because you're right here in DC. You don't need a hotel room. You can attend the conference and be a part of that. And if we have time at the end, I'd love our current students to speak to that experience. In year 2, we spend the summer doing 2 major things. The first is you start clinical. And so you're going to be in clinical 3 days a week. And you'll be working hard at, starting to develop your clinical skills and sort of making that transition from an RN to a nurse anesthetist. And then at the same time, you'll be starting your scholarly project work. And so you'll take a course, Evidence-Based Research Methods. Well, we're going to cover some basics in research, statistics. We'll cover some good writing skills, and you'll write a few small papers where we'll kind of work on your writing skills. You'll pick your scholarly project topic, and you'll be assigned your mentor or your first reader for that. Then in the fall, we continue along with that. Now you're going to write your literature review, you're going to write your methodology, and you're going to apply to the IRB to conduct your study. At the same time, you're continuing your clinical work and developing your clinical skills in clinical practice Monday, Wednesday, and Friday. And then you'll be taking healthcare ethics and a course called Advanced Principles in Anesthesia. In this course, you're going to be learning how to do regional anesthesia. So we'll cover anesthesia for orthopedics, for example, and then you'll go in again to that cadaver lab and you'll place a brachial plexus block on the cadaver, or at least look at the anatomy and the way it relates to landmarks, etc. We have ultrasound simulations as well that we do. So we really integrate regional anesthesia into this course and give you you'll take some other, or you'll have some other modules like anesthesia for ENT surgery, anesthesia in remote locations, things like that. And then in the spring, again, now you're continuing with your scholarly project, you're collecting your data. You're also in Advanced Principles 2, so you're continuing to delve deeper into providing anesthesia with patients with liver disease, patients with in trauma, I believe. We've switched some of these topics around, but some of the larger advanced principle topics, you'll be taking professional aspects, and again, continuing to provide clinical anesthesia under the guidance of a clinical preceptor 3 days a week. Then you move into the summer of year 3, which is exciting, your last year. You'll continue your clinical research seminar. This is when you are going to work with a statistician to analyze your results, and you're going to begin finalizing your scholarly manuscript. Now you move to 4 days a week of clinical. In the fall, you continue to wrap up your research, get ready to do a poster presentation. Hopefully, you'll be preparing a manuscript for publication. We don't require that, but we highly encourage it, and is actually required for an A in your last anesthesia research class in the spring. You'll have more advanced principles in anesthesia. We cover things like cardiac anesthesia, neuroanesthesia, and pulmonary anesthesia. You're in clinical 4 days a week. Finally, the very last semester, you're finishing up your DNAP project. You'll give a formal public presentation, and you'll answer your committee's questions, similar or analogous to a defense that someone getting a PhD would do, but slightly different, but it kind of in that same spirit. And then 709 is a board review course. So we get you ready to take the boards. We get you actively engaged there, and you're finishing up with 4 more days of clinical practice. So at Georgetown, within our program, we follow the larger mission and philosophy of the university. And one of the guiding principles is cura personalis, or care of the whole person. While we're training you to be a competent nurse anesthetist, we also recognize that is not the only piece of you, and that you have a life outside of anesthesia. And we value, although there's not a lot of time for a social life, we value the unique aspects that every student brings to the class. We value health above everything else, and we will always tell you your health is more important than school. We really emphasize this. And then as we're providing care to our patients as anesthetists, we're not just taking care of a total knee replacement. We're taking care of a whole person who brings a unique background and social situation and experiences and health to that procedure. And our goal, of course, is to improve the health and well-being of all people, students, faculty, our patients, and the greater community. So you'll have clinical rotations in all of these areas. And again, our goal is to provide you with a good, solid, basic foundation so that whatever interest you have, you can go out and pursue it. We don't generally encourage our students to become independent practitioners off the bat, although occasionally students do it, and they've been extremely successful. We have several graduates in independent practices. By independent, I mean they do not work under the supervision of an MDA. They're in a CRNA-only practice. So our clinical rotations, you'll have general surgery, you'll have satellite or non-OR. So in this, you'll do things like gastroenterology, where we provide anesthesia for colonoscopies, upper endoscopies, MRIs, things like bronchoscopies. You'll do a pediatric rotation, an obstetric rotation. And by rotations, usually these are about a month. Sometimes if you're not getting a lot of cases in that month, you'll end up getting 2 months so that you meet all required numbers. Our students almost always greatly exceed the minimum numbers required for graduation and to sit for the boards. You'll have a trauma rotation, cardiac, vascular, a thoracic, neurosurgical. We include a pain management where you'll work with a pain management specialist, which may involve managing pharmacology, or also may involve performing regional blocks for pain management, transplant, orthopedic, ear, nose, and throat, and then finally a regional rotation. Although I have to tell you, in a lot of these others, you'll get regional. For example, obstetrics is almost all regional. You'll do a tremendous amount of spinals and epidurals on that rotation. So we have several clinical sites, as I mentioned, across the greater DC area. Georgetown University Hospital here at Georgetown serves as one of our primary sites. Washington Hospital Center, a level 1 trauma center within a few miles of Georgetown, is also a really important site to us. Sinai Hospital in Baltimore, St. Agnes in Baltimore, and Commonwealth Anesthesia Associates in Richmond, also clinical sites. And then finally, Mary Washington Hospital. When we match students to clinical sites, we take a couple things into consideration. One of the most important things, of course, is location. So typically, when Nicole is assigning clinical sites, she'll consider where you live. If you own a home in Richmond, and you say, I really want to go to Richmond, she will put in for you to interview to go to this site. If, on the other hand, let's say you live in Silver Spring, Maryland, and it's much easier for you to get to the Baltimore sites, she would consider sending you to Baltimore. There's one major caveat to this. The clinical sites all have very unique personalities and cultures, and different students have unique personalities and strengths. And we will usually consider whether it's a good match with student personality, student strengths, and the clinical site's culture. And if for some reason, we don't think it's a good match, we may kind of override the proximity issue and put a student where we think they're most likely to be successful. But again, our primary objective is we want the student to be in the learning environment that best matches their needs and their strengths. We also have enrichment sites. Our primary sites can't provide every experience, and we also don't always think that's a good thing for someone to, spend too much time in one place during their training. We want you to see the different ways that different CRNAs practice. You'll see a wide range of practice profiles, and so it's nice to rotate through. It will also help you to get your numbers. So sites where you may rotate if you come to see us, the VA in Washington, D.C. Has served as a wonderful site for cardiac. Also, we have this population is full of a lot of patients with several comorbidities, and it's a very good learning experience for our students. University of Maryland Medical Center and R. Adams Cawley Shock Trauma in Baltimore is in a wonderful site. As a student, I rotated there. I got to put in central line after central line, and you get really good experience with intubating patients with C-spine injuries. It's a great rotation. ANOVA Fairfax has some wonderful cardiac, peds cardiac, a really nice mix of cases. ANOVA Vernon, they do a ton of regional anesthesia. Alexandria Hospital is a nice local hospital that provides a real wide range of surgical experiences. UVA is a new addition, again, provides a lot of great cases, as does Union Memorial up in Baltimore. And then I mentioned earlier the Northern Navajo Medical Center in Shiprock, where there's a large pediatric population. And again, as I mentioned, the CRNAs practice very independently and often in patients with less than ideal baseline medical care. So it's a really wonderful experience in taking care of vulnerable populations and in viewing really independent CRNA practice. So a huge asset to our program. Okay, so now we're going to go into some admissions information. So our deadline for fall 2019, this would be for a June start date, would be October 15th. We need official transcripts from every undergraduate institution you attended, even if you only took one course there, a professional resume or CV, a personal essay really telling us why not only Georgetown is for you, but why this career is a good fit. And then we have a supplemental clinical form that will give us a little bit more information about your clinical background. And we require 3 letters of recommendation. If you know a nurse anesthetist and they know of your clinical skills, this is a wonderful option. If you've only shadowed a CRNA for 1 or 2 days and you don't know them very well, that may not be the best choice. Getting a letter from a clinical supervisor is important, and also getting a letter from someone who knows your academic ability, like a professor from undergrad, is also preferred. But again, a total of 3. And we don't necessarily require them from certain people. It's just ideally you'll have clinical supervisors, someone who knows your academic background. And again, if you know a CRNA and they can speak to your clinical skills beyond just a few shadow days, again, that's helpful, but not absolutely required. Okay, and here's the nurseanesthesia.georgetown.edu is where you can apply. We do require a minimum of 3.0 cumulative undergraduate GPA. We also will separate out your basic science GPA, so things like physics, chemistry, pharmacology, microbiology, and we want to see a 3.0 there. The reason why is we have very rigorous basic sciences in our program, and it's not that we just have one at a time. As you could see from the curriculum, we're often running 2 or 3 at the same time. And so it's really important you have a strong foundation to be successful. So that's something we look at really carefully. Completion of an undergrad statistics course with a B or higher is required. And then we prefer that within the last 5 years, you've taken an undergraduate chemistry course. If you're a real strong student overall and you took a chemistry 7 years ago, we will still look at your application. But again, if you've taken it within 5 years, that's stronger. We do require the GRE for students with a cumulative GPA of less than 3.5. Okay, we do require a minimum of 2 years critical experience by the time of application. So if you're not going to have 2 years until December, you would not meet our criteria. We feel strongly that this is important because you're going to go an entire year out of clinical practice. And so with students who only have a year, year and a half, that's usually not enough to sustain them for that period they're out. Learning all the basic sciences. When we look at those 2 years, we also look at the quality of the intensive care unit you've worked in. So we want to see that you've been actively involved in ventilator management, actively involved in advanced hemodynamic monitoring, managing IV, invasive arterial and venous lines, managing and titrating vasoactive medications, epi, norepi, etc., and that you've taken care of a pretty wide population of different medical needs. So the more general your ICU, the better. We do require you have a current RN license in the US. And again, we prefer a surgical ICU. That is not absolutely required. We've had many successful students from medical ICUs, from cardiac ICUs, from pediatric ICUs. But again, surgical ICU, because you are going to be accustomed to taking care of surgical patients, is going to be the gold standard preparation. But again, not absolutely required. So because nurse anesthetists essentially have another person's life in their hands, and that person relies on our eyes, our ears, our brain for survival, we do have technical standards that are absolutely required for admission because they are required to provide safe anesthetic care. So you need to be able to observe, communicate, have adequate motor skills to perform tasks like intubation and placement of invasive lines. You need to have intellectual, conceptual, integrative, and quantitative abilities. For example, you need to be able to calculate, do some basic math in your head if you need to calculate a drug dose. And you need certain behavioral and social attributes, meaning you need to be able to advocate appropriately for your patient in the operating room, often with several difficult personalities in the room with you. Okay, and so this is my last slide. I think I'm going to turn it over to Edith again for some of our questions.
Thank you, Dr. Bowman, for that wonderful presentation. We have now concluded our presentation of our curriculum in our program. We will now refer to any Q&A or questions that you might have submitted throughout the webinar, whether through the Q&A or the chat boxes. If you have any questions at this time, please submit them now. And we will, again, follow up with any questions that we either don't get to or that we don't have answers to via email at a later time. I have one question's come up, and that is, I think someone missed this when can I have a job while in the program? Um, Dr. Bowman, are you able to address that?
Yes. And by yes, I mean no. There is absolutely no room to have a job during the program. And I think I would almost like the students to comment on this. But just from experience, having taught for 10 years over 10 years in this program, anytime a student has tried to fit some clinical shifts in, we've typically noticed a drop in their grades. It's just really hard to keep up with everything. So we would discourage it. I don't know if Carter or Kayla want to weigh in if they think this would be possible.
I don't think. Oh, go ahead, Carter.
I was just going to say, I don't think it's worth it. I think it would be too much of a risk. You're really devoting so much time, energy, and money to this program. And if you're going to try to take a risk and, see if working works out for you, and if you are unsuccessful, you're really wasting your time, energy, and money. So I don't think it was worth it. I didn't do it, and I would never recommend doing it.
No, I don't think there's a single time. I just saw another question pop up. There's definitely not a single time throughout the program that it would be feasible, because like Carter's saying, you cannot give 100% to both things, and there's absolutely no way that you can give 100% to school if you're pulled in the other direction of work, not only time-wise, but just like the energy and the mental capacity. Your focus really has to be school.
Great, thank you all for answering that. Another question that has come up is, during clinical rotations, will we be competing for experience with other anesthesia students, whether it be anesthesia residents or dentists, etc.? Dr. Bowman?
Well, we do. Some of our clinical sites do have anesthesia residents. We actually also have, Georgetown now has anesthesiology assistant trainees. And generally, we monitor very carefully if our students are getting the cases that they've been assigned to get at a clinical site. If we determine, or if we hear any complaints from the student that they feel like, that they're getting pulled from cases to go to residents and so forth, we immediately address it. And that has always been very effective. Our clinical sites really respect our students. And it's interesting what you'll see if you look at the year, and in July, we have a lot of the new anesthesia residents starting. And so what we'll see is a lot of our senior SRNA students start getting really good cases because they're some of the most experienced trainees there. So again, it ebbs and flows. It's something we monitor very carefully. And if we ever suspect that that's happening and that our students are not getting a valuable clinical experience, we will pull the students from the site.
Thank you. Another question that has come up is, where do students typically live?
That's a good one for Carter and Kayla.
One of you be able to answer that?
Yeah, it depends on what travel accommodations that you have. If you are close, if you don't have a car, if you prefer to live right near campus, there's an area called Glover Park that is nice, and a lot of the Georgetown students live there. If you are from the area, I know Kayla lived here before, and if she wants to talk, she lived in, the outskirts, the suburbs, and she had a car that she drove in. And there are many neighborhoods around that are nice, and there are free shuttles that go from like DuPont Circle to Georgetown, and there's one that goes from Roslyn to Georgetown. So there's a couple different options that you can use even if you don't have transportation.
Thank you. What can we expect from the interview, Dr. Bowman? Would you be able to address that?
Sure. So in the interview, typically what we do is something similar to what we've just done, where we'll present a PowerPoint and go over the major aspects of the curriculum and answer any major questions that the group has. And then typically you will come in for individual interviews. It varies occasionally, but usually what you'll have is 2 faculty members to 1 student. Always just 1 student. You're not interviewing in a group. And we'll just basically ask you questions about your clinical experience. We'll go over your portfolio, and typically, we'll talk about the strengths of your application, and maybe we'll ask you about certain things that give us pause. So for example, sometimes, I think a lot of you can probably relate to the fact that you're not the same person now as you were when you were 19 in your freshman year of college or 18 in your freshman year of college. So sometimes we'll notice on a transcript, someone may have gotten a C early on in a chemistry or something and then gone on to be very successful later on. We'll often ask about that and ask the student, to kind of explain what was going on and why we should be confident that they're prepared at this point in their life. We'll also have you talk a little bit about your clinical experience, and we'll sometimes ask clinical questions, not always. Usually it's anywhere from 10 to 30 minutes, just depending on how many questions we have and then how many questions you have. Sometimes the students have just as many questions as we have. So that's typically how it goes. And then you'll move on to a student panel, and we'll have a group of students interview you as well. And you can also ask those students questions so that you can understand if it's a good fit for you. And that's what I'd emphasize. The interview isn't just us, figuring out if you're a good fit for our program. It's also you figuring out if the program's a good fit for you. And we encourage you to look around. We encourage you to go to other programs and make sure this is a good fit. We really recognize this is a huge investment, and we want to make sure every student that starts here graduates. That's a huge priority of ours. So that's the point of the interview, is just making sure that it's a good fit all around.
Thank you. I have a question that's come up about how big is the cohort and what is our typical acceptance rate. We currently have 3 cohorts. We have a class of 21 students, 24 students, and 25 students. We interview between October and November, and we would interview about 3-4 times during those 2 months. Ms. Lyons, are you able to address the question about the acceptance rate?
I think what's important for all applicants to realize is that you want to choose a program that's a good fit for you in terms of the criteria for admission. Certainly this program at Georgetown, as Dr. Bowman-Daly reported, is a high science curriculum. So if you really have strong science base and you have a really strong application with good, strong critical care experience, with that minimum of 2 years experience, you're going to compete very well. We really don't look at our admit rates as much as we look at our students fit for the program. What we want to do is always admit students who we can retain. We never want to admit a student that we don't think they can be successful. So last year, I believe we had a total of maybe 85 applicants. I believe we interviewed perhaps about 40 of those students, and to gain an interview, you have to meet those basic criteria for an interview. And then we yielded a class of, I believe, 24, 25 students. So you can do the math there if you like, but year to year it's different. It really depends on the competitive pool of the group of students that apply. And so it's hard to always predict based on statistics year over year. I hope that helps you.
Yeah, and I just add to that, we would never accept a student that we didn't think would be successful. That is our priority. So the size of class can fluctuate based on that. We do have a limit to the number of students we can take now because of the doctoral projects. And so we typically, will have a limit because we want to make sure that we don't end up with a class that is so large that students aren't given adequate individual attention when it comes to those scholarly projects. So that sort of sets our upper limit.
Thank you. I have just been made aware that our application system is ready to launch. So if you are not able to find the link on our website, it's because it just happened literally a couple hours ago. So that being said, tomorrow when I get in the office, I will upload the link to our website, and you will be able to be directed to the application system. And we will be accepting and reviewing applications through October 15, as Dr. Bowman mentioned. I want to emphasize that because applications are reviewed on a rolling basis, it is extremely important that you submit your applications as early as possible, even if they are not complete and you are waiting on documents to come in. Go ahead and submit your applications. We review transcripts, test scores, and all of that as we get them. So don't wait on all of that to have in your hands before you submit your application. Your application can be pending certain documents, and we will certainly review them and decide on or make a recommendation based on the documents we have at hand. Let's go over a couple more questions as we are running close to the end of our information session. Our next question is, would you recommend a student to take chemistry and statistics over again if the class is older than 5 years? If yes, what? If yes, can the course be taken at a local community college? It is recommended that you take a chemistry class that is within the last 5 years of you submitting an application, and it has to come from a 4-year institution. You also have to submit passing grade of B or better. I hope that answers that. Let's see any other questions that, gosh.
Yeah, I would jump on. So we will accept community college grades, but they are not as strong as a 4-year college, or university. So that's just something to consider. I mean, if right now you did your first 2 years at a community college and your next 2 years at a major university, so all of your basic sciences were at a community college, it is what it is, and we will consider that. But if you are moving forward and deciding, should I take a course, it's always better to go with a university level course or 4-year college course over a community college.
Thank you for clarifying that. Another question that has come up is there parking on site? And the answer to that is no, there is no parking on site. The Metro does not run directly to campus. However, Georgetown has a free shuttle that circulates from DuPont Circle, Roslyn, and Wisconsin Avenue. Additionally, the campus it's served by Metrobus, and we have more in-depth information about our transportation on our website. So I hope that helps.
And I'll just add too, this is Kayla, I commuted in, as Carter was saying, and I was able to rent out a parking spot close to campus and just walk over, which was really helpful. So that's definitely an option as well.
Okay. A question that has come up is, I'm wondering if the program accepts Yellow Ribbon program. I am not sure.
Yes, it does. Yes, this is Mary Ann. We are a Yellow Ribbon school. And if you are a vet or a spouse or a partner of a vet, you have a very customized plans of support from the vets, and you just really need to seek out the Veterans Affairs website, which is on our public page. But yes, we have unlimited scholarships up to $10,000 a year for Yellow Ribbon.
Dr. Bowman, one question that came in is asking if the faculty have an open door policy.
Oh, absolutely, we do. We highly encourage our students to come to us sooner rather than later. And it's very common during heavy exam periods for me to tutor or just give pep talks for 6 to 8 hours some days. So we really encourage students to come to us. We really discourage the idea that a student should try to fly under the radar. We always emphasize that we can help you, we can tutor you up until the point you take that test, but once you've taken the test and earned the grade, there's not as much we can do. So we want to help, we want to be there for you and support you. And I think our current faculty group is just extraordinary in terms of their ability to tutor and support students. So that's something I'm very proud of, and I think we do a good job.
Thank you. Do you assist students in finding an area of study they are interested in their doctoral project? Dr. Bowman?
Absolutely. So what we do is we provide a list of potential ideas, and then we encourage each student actually each group of students at a clinical site. So for example, the whole, we have 3 or 4 primary students at Georgetown right now in the class of 2021. So they as a group met with Dr. Wall, the chair of anesthesia, and asked what the department's research priorities were to see if there was any ideas from the site. They weren't required to do those at all, but if it was something that there was a mutual interest in, they were encouraged to pursue it. Also, what we did is we had 3 sessions where 2 faculty members sat with 12 students, and we went over what their ideas were, or if they had no idea what to do, like we kind of talked through some options, and the faculty jumped in, peers jumped in. We had Mimi, who's the research TA, jump in. So we really work to help you develop your ideas, and we'll be very clear with you when we don't think something is feasible.
Thank you. And I think we are going to be wrapping up. I'm going to be able to answer only just 1 or 2 more questions quickly before we wrap up. Is physics class as a part of admissions requirement? No, physics is not an admissions requirement. A chemistry class is, and a statistics if you haven't had one recent. Another question is, and this may be our last one, is our chemistry course, if the chemistry course is pending upon application, does that put you at a disadvantage against other applicants?
It sort of depends on the rest of the application. So, if you have just a really strong application overall, it may be just the last check in the box. Whereas if you're right at the 2 years of experience, you're in a really small ICU, and you haven't, had a wide range of vasoactive medication experience, et cetera. And then let's say you're a B student at a university maybe that we're not as familiar with, and then you still haven't taken a chem course, yes, that could hurt you.
Right, so it's an overall.
It just sort of depends. Again, as Ms. Lyons was saying, it really depends on the year and what the rest of the applicant pool looks like. But the reason we require that, really, the rationale is we want to make sure that when you have not just 1, but 3 of these classes going at the same time, and then 2 other, non-science classes, all at the same time, we want to make sure you could be successful, because if you get in this and you're over your head, that's a huge financial cost to you. You've taken time off of work, you've taken on debt, you've moved away from a good job and your support system. We take that very seriously. And so the reason we want to see that strong chem grade is we want to be confident you're ready, and that we are admitting you, in a position where you're going to be successful.
Great. Thank you, Dr. Bowman, and thank you, Kayla and Maggie and Carter, Ms. Lyons. Thank you for joining us today. Thank you, all the attendees, for taking time to join us in this webinar. I highly encourage you to look at our website for an updated link to the application system within the next day. I will also post the link to this webinar on our website. I will send it to you via email. I thank you again, and please feel free to reach out to me for any questions that you may have, any clarifications. If you'd like us to review your transcripts before you submit, to just give you an idea or a recommendation, please feel free to reach out to me. My email is posted on this last slide, and so is my phone number. If anyone has any additional thoughts, great. Okay, well, that is all for tonight. Thank you very much.